Well, some of them make proteins, like the tyrosine kinase. Some of them regulate the amount and the timing of proteins. Some of them are suppressors or repair genes. Any one of those can be damaged at any time. If you look at CML, it makes what a shock to this audience, a bad tyrosine kinase. Do you get the feeling that they're not really the nicest enzymes you've ever had? And we knew that in the 1980s. And in the 1990s, late 1990s, the very first medication came out to attack the abnormal tyrosine kinase that was learned about in the 1980s, that was first located on the chromosome that had the abnormality in the 1960s, that was first discovered as a karyotype sort of thing in the 1940s. And what I want you to see is the time limit here. The 1940s to the 1990s. It was 50 years between a description, a thought, a connection, an understanding, and a medication. And I want you to think about that one often, because when you think about what you heard yesterday and the times that we're talking about, and Nicole's slide at one point where she showed you what had happened in the last year and a half, 2 years, things are going for CLL, things are changing for CLL that are immense, both in their quality and in their speed. So there's a huge amount of work going on. So acknowledgement about prognostication, number one, it's too fast for anybody to judge right now. It really is. There's so many researchers out there looking for various things. There are so many drugs in clinical trial. There are so many more things than chlorambucil and prednisone. And think of the timeline. That was something that you were using in the 1980s, 1990s, and look what you've got now in comparison to CML, which started in the 1940s-ish, and didn't get to have an effective treatment until approximately the year 2000. So this is an astonishing level of speed, and those of you who came out of here yesterday saying, I need a drink because I don't understand it, as opposed to I need a drink to celebrate it, or I just need a drink. You should be confused. Welcome to the club. The guys in the front are confused too. Because this is happening so fast that it's hard to keep up with what's going on. Okay, what about regulating the amount and timing of proteins? There are genes that we call operons because they operate. One thing you'll notice about science, we are highly unimaginative when it comes to names, which sometimes causes problems. But here's a really good example of what I mean by operonic activity, items that turn on and turn off. This happens to be the way hemoglobins change over age. When you were, not so long ago, in your first trimester of gestation, you didn't have the same hemoglobin that you've got now. You had something that had epsilon chains in it. And the epsilon chains came up and out of nowhere, and they built you a hemoglobin, and then after a little bit of time, that went away, and another hemoglobin chain called gamma chain came in, unimaginatively forming a hemoglobin known as fetal hemoglobin, because, well, that's what you've got when you are. And then, after birth, that fetal hemoglobin kind of trundles its way down, and adult hemoglobin, beta chains, starts building up. So you have a nice little example of things that can turn on and turn off. So one possible problem with mutations are things turn on, but they don't turn off, or things don't turn on. And there are tons of examples where these kinds of things happen. You turn on a gene to make growth hormone when you're 7, and you become an NBA basketball player at 7 feet 2 inches. You don't turn growth hormone on You not only don't become an NBA basketball player, you maybe are considered vertically challenged. I feel that way every now and then. My husband's 6'2". It's a problem for me. And so height changes. Those of you who might have people that you know who have got diabetes, there's a type of diabetes in which the insulin making capacity of the cell is damaged at the genome level, so they don't make enough of it when they're supposed to. So on and off happens all the time. Some of us change color through the years. Some of us lose things over the years. And that too is part of this on and offness of these genes. Damage an operon, you don't damage the quality of the protein that's being made. It's either not made enough, or made too much of it. What can you do with these genes? Well, you can undergo mitotic division and make another one. That's sometimes good, sometimes not. You scratch your hand on something, you open up an abrasion here, you expect those cells to undergo mitotic division and reseal and heal. On the other hand, you nasty people, you want your white cells, particularly the granulocytes, to grow up, become effective, and die, because they're fighting off the bacteria that you inadvertently introduced to your bloodstream this morning when you took your toothbrush and rammed it right against your hard palate. Oh, you missed, and so you expect your white cells to just go out there, your granulocytes to go out there and eat up all of that bacteria and die for you. So yes, you can make a cell, you can cause a cell to program itself to die for you. If it's going to die, you want it to die at an appropriate time. Don't let it suffer, just let it die quickly. And so you don't want it to be damaged and floating around. We see that a lot. When you look at your CBCs, under the granulocytes, you may see some comments. Granulocytes that have got vacuoles, granulocytes that have got unusual granules, granulocytes that have got something called Durley bodies if you're German and Doley bodies if you're not, because some of us don't believe in umlauts. And those are all indicators that your cells have been under stress and are trying to do things for you and are exhibiting the change that stress can sometimes give them before they die.